Ladies and gentlemen, please welcome Dr. Ada Adamora and Bishop Oliver Allen.
Good morning, everyone. I'm Ada Adamora.
And I'm Bishop Oliver Allen.
We are members of the Presidential Advisory Council on HIV/AIDS, and we are happy to be here. We'll be your MCs today during the morning portion of today's event.
I want to welcome you to Atlanta and the release of our National HIV/AIDS Strategy, which has been updated to 2020. Hello to everyone in the room and watching the live stream from home, your offices, or your organizations. You can follow today's conversation using the hashtag HIV2020. You can follow this conversation by using the hashtag 2020, HIV2020.
So, beginning with plenary 1 at 11 a.m., we will be taking questions for the panelists from Twitter. So anyone in the room here in Atlanta or watching online can submit their questions, again, using the hashtag HIV2020.
We hope everyone will stay engaged. So without further ado, let's begin. Please welcome the President and Dean of Morehouse School of Medicine, Dr. Valerie Montgomery Rice.
Good morning. You know, for about 34 years, we've been chasing a cure for a virus that's elusive. And as my friend and colleague, Dr. James E.K. Hildreth says, HIV/AIDS is a thief. This virus is a thief. It comes into your home, which are your cells. It steals your proteins and then repackages itself so it can continue to be elusive. And despite the multiple medications and advancements in the treatments that have moved HIV/AIDS from deadly to a chronic disease, the virus continues to plague our most vulnerable populations. It remains a health crisis among minorities. According to the CDC, African Americans are the racial ethnic group most affected by HIV. The rate of new HIV infections in African Americans is 8 times that of whites, based on population size. Blacks represent 12% of the population, but account for an estimated 44% of the new HIV infections in 2012. And it is estimated that 88% of women who are living with HIV are diagnosed, but only 32% have the virus under control. This is why these types of conversations continue to be relevant. Until now, we can narrow the gap. We can reverse the mortality. But until we really do narrow that gap between the impact of this disease, we will never achieve health equity. So with that in mind, it is my distinct honor to welcome you to the Morehouse School of Medicine for the White House update on the National HIV/AIDS Strategy. I want to recognize Douglas Brooks, who I had the opportunity to work with when I was on the board with the AIDS Foundation. He is the director of the White House Office of National AIDS Policy. We also have the Deputy Assistant Secretary for Health and Infectious Disease, Dr. Rana Valerie. We also have with us our 19th Surgeon General of the United States. Dr. Murthy is here. Additionally, I think we have representing the Mayor's Office, the City Commissioner, Yvonne Yancey. And lastly, but certainly not least, I want to recognize our own Dr. David Satcher, who is the director of the Satcher Health Leadership Institute here at Morehouse School of Medicine, and was the 16th Surgeon General. We also have a good friend to Morehouse School of Medicine, Pamela Roshell, who continues to work in many fronts in this region, serving as the Regional Director for Region 4. And I also am privileged to have my Vice Chair of my Board of Trustees here, Ms. Susan Grant. We are streaming live today, so I want to extend a welcome to everyone who is joining us via live stream, aids.gov. Again, Morehouse School of Medicine remains committed to improving the health and well-being of individuals and communities, diversifying the healthcare workforce, and advancing primary healthcare through programs in education, research, and service. We look at these opportunities to engage with the community, to engage nationally, to engage regionally, and internationally as our opportunity to let you know that we stand with you in ensuring that the strategies that are outlined by the White House to fight this deadly disease, we will take them on here at Morehouse School of Medicine, and we will serve as your conduit to our community partners and to those partners that we don't yet have. We will be your voice. We will be your voice, and we will continue to be the voice for the voiceless. Thank you so much for coming here, and I look forward to you having an outstanding day. Thank you.
Thank you very much, Dr. Rice. Next, please welcome the Director of the White House Office of National AIDS Policy, Mr. Douglas Brooks.
Good morning. It's here. And as a matter of fact, it actually is here. And so those of you who are watching online, about 20 minutes ago, the President signed the executive order implementing the National HIV/AIDS strategy. And yeah. And to be precise, because we should be, the title of it is Implementing the National HIV/AIDS Strategy for the United States for 2015 to 2020. So for those of you who are watching live stream, hi, and everything is available online at aids.gov and should be also on whitehouse.gov. So all the materials, including this. And for those of you who are here, when we head out to lunch, you will each get a copy of the updated strategy. So thank you, Dr. Rice, for the welcome, and thank you for having us be here today. You know, there's sometimes people say my home girl, but Dr. Rice really is my home girl. We both were born and raised in Macon, Georgia, so just right down the road. And I have to give a special shout out to my childhood friend, Beverly Hudson, who's here from Macon this morning. And something you don't know is that Carrie Dumas, who is your Director of Alumni Relations, and my family and her family have been friends for 3 generations. Her grandmother and my grandmother were best friends. So there is a real personal Morehouse connection. And there's a real, I'll say more about the reason for us to be here, but I also want to thank Dr. Rice's team, Daniel and Dan, Rana, Tony, and Padara for making today happen. To Vice Chair Grant, thank you so much for your leadership of this organization and this institution, and you should know that your team, your folks here, have been amazing and have made us feel so welcome. So thank you for that. I also want to thank our special guest, Surgeon General Murphy, for being here, and former Surgeon General David Satcher, and we're looking forward to hearing from them. And I want to thank all our federal officials here today, most of whom have dedicated years and some decades of their lives to fighting HIV in America and abroad. And they spent the last 5 years implementing our national HIV/AIDS strategy. There are too many names for me to call everyone, but of course I want to acknowledge Dr. Ronald Valdesari I want to acknowledge Andrew Forsyth and Tim Harrison, Dr. John O'Marman and Dr. Eugene McCrae, Shannon Hayter, Deborah Parham Hobson, Antigone Dempsey, Bob Eisinger, and so many others who do this hard work. And I have to give a very, very special thanks to I don't know if I have the adjectives, the superlatives to describe Miguel Gomez, who and his entire team who run AIDS.gov, which we all use and love, and for all their work of making today a reality. So I'm going to ask you to join me in thanking Miguel, please. I have to also give thanks to GMHC and San Francisco AIDS Foundation for their literal partnering with us on communications and on and getting the strategy out to you. A lot of the things that you will see, they actually lent their communications departments to us and were just a tremendous gift. We have, I don't know if Sandy's here yet. Is Sandy Thurman here yet? At some point, we'll have two former ONAP directors in the room as well. Jeff Crowley is here, and yeah. And now that, so Greg Millett, I need to say to you, now that I've gone through this, I understand what you meant to Jeff. So I want to also acknowledge Greg and Jeff, who developed the first strategy, or the current strategy, and so glad that you're here. And Grant Colfax isn't here, but I want to give him a shout out too. To all of them, to all of you who are here, and to our friends in Baltimore, I think the count as of this morning, there were 124 of you gathered together to watch this event. Hi from Atlanta. So maybe everybody could turn and look at that camera and wave and say hi to our friends in Baltimore. Hi. Thank you. I think there may also be a watch party in Miami and one in San Francisco. And if there are other people who are gathered watching us, we're honored that you took the time to do so, and we hope that you enjoy.
Hi, everybody. Let me offer a special thank you to everyone at Morehouse for hosting this event, and to everyone tuning in for your efforts over the years to combat HIV/AIDS in America. It's hard to believe, but it's now been more than 3 decades since the first cases of HIV and AIDS were diagnosed in the United States. For many Americans, those early days of the AIDS epidemic were marked by fear and by stigma, by how little we knew about the disease, by a lonely fight to be seen, to be heard, even to be treated with basic compassion. Times have changed. Prevention, treatment, and care have saved millions of lives, even in the world's poorest countries. Testing and access to the right treatment mean that being HIV positive, once perhaps a death sentence, can still mean a chance at a healthy and productive life. But our work is far from finished. 1 in 8 people with HIV still go undiagnosed. Only 3 in 10 people with HIV have suppressed the virus in their system, lowering it to an undetectable level. And this disease still affects different ages, races, sexual orientations, and even different regions of the country in disproportionate ways. That's why this is the first administration to release a comprehensive strategy on HIV/AIDS, and that's why we are updating it for the rest of this decade. It seizes on the rapid shifts in science and policy as we've learned more about this disease. It calls for widespread testing, full access to services that reduce the risk of acquiring the HIV virus, and guaranteed access to regular doctor appointments. And it focuses on making sure that every American, no matter who you are, where you live, or how much money you've got, can get access to life-extending care. We've come a long way in the fight against AIDS, and we can't let up now. For those whose lives are still at risk, and for those who didn't live to see this moment, let's keep working for an AIDS-free generation. Thanks. Your president truly sends you his greetings, and
the folks at the White House were very excited about the rollout of this strategy, and I actually have been asked by two people, Cecilia Munoz and Valerie Jarrett, to bring you their personal greetings, to wish you a great day, and they're both looking forward to our work together to implement the strategy. I also wanted two bodies that I wanted to acknowledge that I didn't earlier. The members of our Presidential Advisory Council on HIV/AIDS, the PACHA, and the members of the CDC HRSA Advisory Committee, both of whom were truly instrumental in helping us develop the strategy as well. So we've updated the strategy, and I've told you it's available. The strategy will guide our work, all of our work, from now to 2020, building on the successes of the original strategy, the incredible scientific advancement of the last 5 years, the tools that have been developed, and that you've helped to implement across the country. The updated National HIV/AIDS strategy will serve as our national roadmap through the end of the decade to reduce new infections, improve health outcomes, and reduce the huge disparities that still exist. Our office has traveled the country, worked with our federal partners, reviewed your submissions, and heard your voices. What you will find in this document are our goals by 2020 and the key steps to meet them. What it will take to get there by following the science, for the right people, right places, using the right practices. You will hear more about what specifically the strategy calls for a little later, but let me say something up front. It is clear, and in the strategy it's clear, what we need to do. We need to use the best tools and practices to improve health and stop infections. This includes testing, PrEP, and providing supports that allow people to stay in care and sustain viral suppression. And we need to get these to the communities that need them most now. Let it be said loud and clear for the nation to hear. Black lives matter. Black women's lives matter. Black gay men's lives matter. Black transgender women's lives matter. And over the next 5 years, our strategy is to reduce the burden among blacks and black gay men as much as possible. As with the original strategy, the updated strategy remains a broad policy document that delineates this administration's priorities and the broad steps we need to take in order to meet our goals. You'll hear this said a lot because it couldn't be truer. This is a national plan, not just a federal one. All of you here and those of you watching around the country represent the various disciplines in which we will work to ease the burden of HIV in our communities. Service providers of all kinds, networks of people living with HIV, advocates, researchers, policymakers, faith leaders, community leaders, business leaders who span all of these groups. In December, on World AIDS Day, the White House, working with our federal partners, will also release a federal action plan that will spell out the specific action items to implement the updated strategy through 2020. So you can help keep us accountable through 2016, 2018, and 2020. You'll hear more about that. As we look toward 2020, let us make a renewed commitment to each other and to ourselves. Let's work together better. Let's be more open to change. Let's always make sure that our first priority is the people that we serve and the struggles that we've dedicated our lives to alleviating. Let us ring true the words of the President, that no matter who you are, no matter where you live, no matter how much money you've got, that the vision of the strategy will one day ring true as well. That the United States will become a place where new infections are rare, and when they do occur, every person, regardless of age, gender, race, ethnicity, sexual orientation, gender identity, or socioeconomic circumstance, will have unfettered access to high-quality, life-extending care free from stigma and discrimination. I want to also, I'm going off script and they get scary when I do that, but I promise you it'll be okay. I'm looking into this camera, and I just want to say to some young girl who may be being trafficked, to some young gay man who is being bullied and tormented and tortured, to a woman who may be picking up the pieces from being beaten last night and controlled. We want you to know that we love you and that this strategy is about you, and it is about the healing of this nation, and it's about HIV and the eradication across this country. We are committed to that. We're committed to it at the White House. We're committed to it in this room. We're committed to it. 700 people on a call yesterday. You feel alone. You are not alone. You are loved and you are cared for. And we promise you we will deliver. For now, thank you.
Will you join me again in appreciating Douglas? Come on, you can do better than that. Thank you, Douglas, for your work, your hard work, your commitment. Next, please welcome Dr. Pamela Roshell, our Regional Director for Region 4 of the U.S. Department of Health and Human Services.
Well, good morning. Welcome to Atlanta and welcome to Region 4 of the U.S. Department of Health and Human Services. Secretary Burwell sends her best for today. Let me extend my thanks and appreciation to Dr. Montgomery Rice for your leadership and for the unwavering commitment of the Morehouse School of Medicine family. You have been dedicated partners with HHS, dedicated to eliminating health disparities and providing critical health care needs for those in Georgia and across the region, so thank you again. We are all here today because we share President Obama's belief that an AIDS-free generation is within our reach if we continue to work together to make it so. So guided by the National HIV/AIDS Strategy, agencies and offices across the U.S. Department of Health and Human Services are working to strengthen HIV prevention, care, and treatment efforts. As we speak, NIH grantees and scientists are hard at work exploring ways to treat HIV infection by administering anti-HIV antibodies. The FDA has approved new rapid diagnostic tests that can be used in a variety of settings to identify HIV-infected individuals. At HHS, we have worked with leading pharmaceutical companies and foundations to create a single, common, and common sense application for patient assistance programs. SAMHSA is investing in screening and assessment for people with HIV and in need of health and mental health, substance abuse treatment. Our very own Region 4 Regional Resource Network program is offering innovative strategies for HIV/AIDS prevention, education, outreach, and stigma reduction. In addition, our HRSA Ryan White program remains a vital element of HHS's national response to HIV, supporting critical efforts to engage and retain clients in care, demonstrating improved health outcomes, and the provision of primary care services for those who are uninsured and underinsured. In Region 4 alone, the Ryan White program has served over 119,000 HIV-positive individuals. Another step in meeting the goals of the National HIV/AIDS Strategy is the very important Affordable Care Act and implementation of this law. As many of you know, the ACA is one of the most important laws in history and in our fight against HIV/AIDS. Already, the law has expanded access to HIV screenings and ends some of the worst insurance company abuses, like denying coverage for pre-existing conditions like HIV infection or putting lifetime caps on care when a patient needs it most. So as I reflect on the progress we have made, I know that there is still much work left to do. The challenge that we face here in Region 4, here in our southern states, is substantial. Southern states are now known as the epicenter of HIV/AIDS in the United States. Over 288,000 people in Region 4 are living with diagnosed or undiagnosed HIV infection. Nearly half of those individuals live in the state of Florida, over 57,000 live in Georgia, and over 30,000 live in North Carolina. So today, let's rededicate ourselves to working with other healthcare leaders across the region, across the nation, and around the globe. Let's fortify and intensify our efforts in HIV prevention, testing, care, treatment, and research, so that Americans can continue to access health-preserving, life-extending HIV prevention, medical care, and interventions. Because of our work together, we are saving lives and ushering in an AIDS-free generation that we know is within our reach. Today, I am grateful to work with all of you, and I thank you for your commitment and continued dedication.